hear you, ma'am.
Hello, good evening to all of you present here. So I'm going to be talking about first a brief, very brief, and thank you for that wonderful introduction. Um, just talking about very briefly in terms of, and you've heard already Dr. Parekh and Divya from our team talking about our programs and what we've been doing. I particularly head the school mental health program. I am a clinical psychologist myself. And as a part of the school mental health program, we've been working with schools for more than a decade in making mental health awareness across schools, amongst students, teachers, parents. And this is something that we've been doing absolutely free of cost because our vision is to create mental health awareness across the country in schools. And we strongly believe that if we want to bring about a change and bring about and change the positive narrative around mental health, the change happens through young people. And this is the reason why um, young people need to be aware of what mental health is and have the right kind of knowledge about mental health and mental illness. And so
Ma'am, in case you're speaking, we are not able to hear you. Okay, I think there is some technical glitch. Okay, so meanwhile, I would request our technical team to please play the videos until our speaker is joining back. Thank you.
yeah, I'm
Yeah,
sorry
ma'am.
about the internet connection was a little stable, knowing that network stability is a little issue
No problem, ma'am.
today.
Yeah.
So, continuing from where I left is, so we've been working with schools, and we strongly believe that children and the significant adults around children, where they spend around 13 years in school needs to be and is one of the safest and secure place, a secure base for young children to grow. And over there, if we bring the element of mental health and we talk about that, I think we are going to make a significant change and a much needed change when it comes to mental health. So, the reason why mental health curriculum is needed in schools is, let me bring about certain facts. So, the fact is that 10 to 20% of adolescents experience mental health conditions, and suicide is the third leading cause of death among 15 to 19 years old. And if we talk about the age group when half of mental illnesses actually begin is at the age of 14 years. So you can actually imagine, and these are all statistics from WHO. So you can imagine that if we are able to diagnose mental health conditions at an early age, early identification is going to help us, bring about a much needed intervention at an early age. And we will be able to deal with mental health issues at a much earlier stage in life than waiting for them to grow as an adult and keep on struggling with mental health and mental health issues. We are very much aware of the stigma that has been prevailing with mental illness, and there are multiple reasons of why the stigma is there, and I'm going to be talking about that in my conversation today, that why stigma is prevalent, and it's across the globe, it's worldwide. And if we talk about how many people actually who are struggling with mental illness able to seek treatment is only 75%. So we can look at why and how stigma actually acts as a barrier as well. And of course, accessibility and care are other reasons of why treatment is not available. But for us to be able to understand that, because of stigma, help seeking does end up becoming a barrier. And there are multiple socio-cultural factors and other factors which are prevalent for keeping the stigma as a perpetuating factor. So what are the things that have changed for an adolescent in today's time, for the youth in today's time? With the heavy demands that the modern life play, we have so many things even at an early age that we have to look at, whether it is our academics, whether it is competitions, whether it is the pressure that we feel of people doing so many things at a young age. People are achieving big goals, doing big things, and that also creates an unnecessary pressure on our mind. And then, of course, the lifestyle change that has gone through, changes in the family structures that we look at. We look at dysfunctional relationships. The whole meaning of relationships have gone through a lot of change, and the rapid socio-cultural changes, negative peer influences, whether it is substance abuse, whether it is pornography, whether it is anything else. We look at negative peer influence as well, whether it is bullying, and rising aggression and violence in the society. There is so much that we see on news, on happening around us. I mean, just recently we saw how violence and aggression was represented in our country, and that also tends to have its own mental health impact. So watching news and taking a lot of download from that can also be a trigger for us to not understand as to what's actually happening around us, and can trigger anxiety in each one of us. And then, of course, the social media, the kind of social media intrusiveness which is happening in our life. And it's very, very important that we understand that how digital media is here to stay, but yet it is becoming intrusive. No matter how much we try, but we are unable to sort of stop our own impulses and urges to be there on social media, to be feeling that we may be missing out on something. The feeling of connectedness that we feel because of social media existence, even though we may not be really connected over there, but we still feel that there is a connection. And that's actually the irony of social media. I mean, it has its own positives, but it also has its own negative for that matter. And excess of anything is, of course, harmful to us. So it's very important that we understand the kind of changes that young generation has been going through, and the kind of communication gap that it has been creating amongst young generation. Communication is getting impacted. People don't talk directly. It's either through messages. It's even communication with our own parents, with our own grandparents, that's gone through a lot of change. So all of these things has its own psychological impact, and how mental health issues have been becoming on a rise. And so, which is why, if we want to sort of create a certain kind of a change in our society when it comes to mental health, and if we want to break the stigma for any topic for that matter which has been prevailing, and today we are talking about mental health, it has to happen through education. Because the right kind of education and awareness and information on any topic which has been stigmatized for a very long time is the right way and the right channel to be able to break that stigma. Stigma happens wherever there is lack of awareness. Stigma happens when we have preconceived beliefs and notions about a certain subject, a certain illness, uh, because again, there is a preconceived notion, and where we do not have much information about what is right and what is wrong. And so the mental health curriculum is what we came up with. It's a manual which has 5 modules. We had published and written it in 2018. It has been published by Macmillan, and the manual consists of 5 modules. One of the modules is, and I'm going to talk about the modules over here in very, very brief. So one of the modules which is there is understanding mental health and mental illnesses, recognizing the signs and symptoms, which means we train teachers on recognizing the signs and symptoms of what are mental illnesses, whether it is anxiety, depression, different forms of anxiety disorders, mood disorders. Very brief, very simple way. Teachers are trained on this. You can get the manual from Macmillan. You can reach out to them. The manual particularly has 2 sections. One section is the information for the teacher, and the other section is the The second module is rethinking the social language, destigmatizing mental health, which means if we talk about stigma, the reason why stigma prevails is because of the kind of language that we use. We all are aware that how insensitive we can be when we talk about mental illness, and we all have certain notions about how people with mental illness have been seen for the largest time. Media has a role to play in that. Earlier, if we talk about evolution of mental health for that matter, in the earlier times where there was very less and science wasn't so evolved, we would hear and see how people with mental illness were treated. And over the years, of course, science has evolved, and which is how the treatment has changed, the awareness has changed, but still there is a long way to go. But somewhere we need to question and break that belief that people with mental illness are crazy, wacko, all these words that we use to define them, and how it becomes a kind of an identification for them. The social stigma that has been created around mental illness, sort of tends to also have any individual who's struggling with mental illness sort of tends to also have a self stigma, where you begin to
I'm sorry to interrupt.
schools, if they get to know that I am suffering with mental illness, they are going to discriminate against me. So we
Okay.
need to
Ma'am, sorry to
understand,
interrupt. Ma'am, I think bandwidth level is low. So could you please try switching off your video for some time? Because no, we are not able to hear. The voice is breaking in between.
right.
Yeah, thank you. Hello, ma'am.
The social stigma that's prevalent, that's also one of the reasons of why people hesitate to talk about mental health and mental illness. So it is very important that we take active measures and active steps to break the stigma by bringing the right information and knowledge. And so this module of we need to know what are the right words to talk about and refer to people with mental illness. It is very important that we give them the same amount of dignity, and we also give them the same rights that we show as a matter of respect to any other individual. So 1 in 5 people, if they are suffering with one form of mental illness once in their lifetime, they are people like you and me. So all these notions that we've had when it comes to mental illness, we need to really rethink about it. So the choice, the kind of mental health and mental illness related perceptions and beliefs we've had, it's time that we begin to sort of give that a backseat and break free from them, and actually accept that mental illness and mental health is a part of our day to day life, and it's like any other illness that we have. So mental illness and mental health has a word health attached to it, which means it is about our well being, it is about our health. And mental health is something which is very integral part of our day to day life. Just for a moment, think about it. If your mental health is not keeping well, it is going to impact your relationships, it is going to impact your work productivity, it is going to also have effect on your physical health. So it is very important that we recognize the importance of mental health over here, and the core integral aspect of our life that mental health plays in our day to day life. The third module is help seeking, which means if we are able to deal with stigma, we will be able to encourage people to seek help as well. And that is going to happen if we change the narrative around mental health. And that is going to happen if we are able to break the stigma. So we need to continue to have more conversations. We have to be mindful of the fact that when we are in a group, we are talking about mental health in a lot more positive way. We don't we are mindful of the kind of words and language that we are using when we are referring to people with mental health and mental illness. We must be sensitive towards mental health and people with mental illness. We must also talk about stories of recovery. That's very important, because if we are going to continue to talk about how people are still they are on medications, and there is no recovery that happens, and there is so much dependency. If we are going to continue to have that negative narrative, then there is going to be stigma, and there is going to be a lot of barrier in help seeking. So which is why it is very important that we change this narrative, and we talk about mental health in a lot more positive way. We talk about stories of recovery. If any one of you have struggled with mental health or mental illness, or anyone, it's important that we talk about how therapy is helpful, how treatment is helpful, how recovery is something that happens. So those stories are hopeful stories, that again creates a positive narrative around mental health. In schools, in fact, there are studies to show that even students, they hesitate to go to a counselor because of the same kind of stigma that one can have. So because you fear that your friends may actually begin teasing you, they may call you certain things, they may think that you're weak, and which is why you're going to a counselor, is why they avoid going to a counselor in school. So which is why it's again important that we do talk about mental health in a lot more educative way, and mental health literacy is the way forward to bring about the right kind of significant change that we need when it comes to mental health. The fourth module that we have is building resilience. And resilience is something that we all can learn. I think in the last 1 year, we've seen how we all have been able to learn resilience as a skill by dealing with such an uncertain, difficult time in our life. And we all have actually developed that skill to be able to survive a difficult time period like this, which was uncertain, which was we were all prepared for. But with the help of our support systems, with the help of being able to work and take one each day as it is coming, we were able to absolutely bounce back with the kind of difficulties and challenges we were facing in our day-to-day life. So again, resilience as a skill, how can we develop that in our children, in our classrooms, talking about that, talking about stories of resilience, talking about stories of hope, making them think critically about what is optimism, how can one develop optimism, who is an optimist. It's very important that we talk about these concepts in our classrooms. And lastly, well-being, bringing well-being as a culture in our schools, in our classroom. Well-being again is a very important aspect of our day-to-day life, and we have to give it the right kind of importance, and that is going to happen if we are all able to work collectively about keeping mental health and emotional well-being as a priority. So it's not just about scores, it's not just about academics, it's not just about who came first, it's not about number of medals and trophies that you've had, but it's about overall growths that you've had in the individual during this time, in your child, in during these 13 years that they are in school. It's something that can have a wonderful impact, a positive impact, that schools and that schools can bring about in children, and which is what we need to understand. Our role, our significant role as educators, as parents, as teachers, that we can, and as counselors, as school counselors, that we can have on young children in our schools. If we are able to give mental health a priority for them, well-being a priority for them, and we are able to invest with the right intent in their life skills, in building that mental health literacy, and bringing them, giving them the right knowledge about it. So as my colleagues have already talked about, that how important it is for each one of us to actually take some time out of our usual work to really invest with a sense of passion in our day to day, in mental health. If you are really passionate about it, if you have a sense of purpose, if there is a goal, and if there's something that you really care about, then you must invest some time out of your day-to-day life bringing about the right kind of change for the purpose that you really feel connected with. And that's everything and everyone in our team has been doing. Apart from our clinical work, all of us spend some time out, in fact 20 to 30% of our times out in different forms of bringing about the awareness in mental health, whether it is schools, whether it is organization, whether it is awareness through social media, whether it is NGOs, community. and which is how we are able to make a 360 widespread change and awareness on mental health. So I urge you all to recognize what your sense of purpose is, in which direction you want to invest your passion and your energy, and if you are able to do it, never in your life will you feel that you're purposeless. And that's exactly what you need to do, and that's how we came with mental health curriculum. India has its first mental health curriculum, and you can always have this manual from Macmillan. They've been our publishers for it. And please go through the manual. If you are a school counselor and educator, we would be happy to do this session and training for teachers in your school. Like I said, our school mental health program is completely pro bono. We don't charge schools for any workshops, any trainings that we do. And there are gazillion topics that we have, even for students, teachers, and parents, to be trained on mental health and life skills kind of topics. So please feel free to write to us. You can reach out to us on mentalhealth@fortishealthcare.com, or you can also call us on our mental health number, which is 9811806117. There are multiple ways of how you can connect with our programs. We'd be happy to connect with you. So anything with schools, please feel free to reach out to me, and I'll be more than happy to support you.
Thank you so much, ma'am, for a wonderful session. So the audience are asking for the name of the manual. So can you please repeat the name again for
So name
them?
of the manual is Mental Health Curriculum.
Okay. And they're asking, is it available on Amazon?
It is no, it's not available on Amazon. It is something that you can procure from Macmillan. It's mental health curriculum, a curriculum for teachers in the classroom.
Okay. There's one more question. It's like teenage minds are usually fragile. Can the internal voices or mental unwellness of the clinical psychologist dealing with the disorder or the flaw in the method employed can worsen the state of the child? And if yes, so how can this be avoided?
I'm sorry, the voice broke in the middle. I'll probably look at over there
Okay,
in the
ma'am. It's in
okay,
the Q&A.
in the Q&A. Okay. Okay,
Yeah,
teenage
the
minds are
last
really
question.
fragile, and the internal voices of
It's
mental ill health of the clinical psychologist dealing with disorder or a flaw in the method employed worsen the state of the child? If so, can this be avoided? I didn't understand the question very well. Uh,
and maybe they are asking that if the clinical
but
psychologist itself is
what we need,
unwell,
right. I'm okay.
yeah,
So
and if
what we
they
need to
adopted the
understand,
wrong method.
right? What we need to understand is that as clinical psychologists, we are trained to keep our biases away. So, if we know we are burnt out, then of course we are going to take our breaks and not get into therapy like that. But anything that we are getting affected with, although that's part of our training. So, we are trained into not getting infected by anything what the client brings to us. Similarly, even our belief systems, our own biases is something that we have to completely keep outside of our, session. And that's exactly what the training is about. It is a non-judgmental space. It's a space where there is expertise, there is training with evidence-based treatment and techniques. At the same time, how do we continue to be empathetic? How do we continue to be non-judgmental in that space? That's part of our training. So no, that should not happen. If at all that is happening, then I'm sure that the therapist or the clinical psychologist would be aware and would obviously withdraw from that particular taking on that thing forward and taking care of their mental health as well, because it is very essential even for us as mental health experts to take care of our mental health too. So yes, if we recognize there is something that might be happening, and we may not be able to go ahead with any kind of work, then of course one takes breaks. It's like, how in any other job, if you think you're burnt out, you take breaks, you take care of your mental health, and then you resume back. It's the same way. Okay, I see a question: how to motivate someone to take up therapy if they are having a bad experience with therapy? Well, I think we all need to be a bit patient when we are getting into therapy. If there is something that you've been having as an experience which is not very good, then it is very important that you also talk to the therapist in terms of what you're struggling with in that therapeutic setting. And if you continue to still feel that it's not working for you, then of course a change of a therapist is something which is recommended. But yes, because therapy is a process, you have to give yourself a little time, and you have to see your sense of comfort which is built in the therapeutic relationship with the therapist, because that's the most important part in therapy. You are able to only bring about a change if you have a strong and a good therapeutic relationship with your therapist. So it's very important that the moment you recognize something is coming in as a part of the barrier for you to perhaps talk about to your therapist, then you must be open about it. You must discuss this as a part of therapy. And if you still feel it's not working out, then of course one can always look at changing the therapist.
Okay, ma'am. We have next question. How to cure a person who eats raw rice,
um, okay,
not
so
boiled
I'm
rice,
not
raw rice? Yeah.
yeah, I'm not going to consider this as a mental health problem. I think we have to look at it. I mean, it could be something else, and it needs to be looked at and spoken to about with a physician. If at all there is something that might be happening from a mental health concern, then a physician should be able to recognize that this is not to do with health, or this is not to do with just a eating habit, but this might be something happening as a result of something else. So and one needs to just go to a mental health expert then.
Okay. So we have one more question. What if the client is not comfortable sharing details to a stranger who is a therapist?
In fact, that's the reason why you go to a therapist, that they don't know you. They are not going to have any bias towards you or the environment that you come from. And that's exactly the reason why one must engage in therapy if there is a need, because you are getting a non-judgmental space. The therapist is not going to advise you. It's not going to give you suggestions. It's not going to tell you you should be doing this or you should be doing that. It's a process where you collaboratively work on whatever problems that you bring in. So it's important that if you recognize there's a problem, you must start therapy.
Okay, ma'am. So we have one more question. How can we stop a person who is seen twirling her hairs always? I think plucking her hair always, one of the.
So okay, so if that's coming in as a part of compulsion, and that's one of the conditions under mental health, mental illness, which is trichotillomania, which is again plucking the hair, and you then see, there are patches of baldness that one can see, or sometimes very lightly one can see that there are patches which are happening. Then again, you need to reach out to a mental health expert. If it's just something which is happening, it could also be part of anxiety, or it could just be otherwise a habit formation. So it's important that before we reach out to a diagnosis, we talk about it to an individual. If they are saying that it's something troublesome and they're not able to deal with it on their own, this means this is something out of their control, and they need to reach out to a mental health expert.
Okay, ma'am. Thank you. And we have another question. Is it possible to completely be cured from a mental health condition like, for example, anxiety?
Absolutely, you can have an absolute recovery from mental health illness. There are certain times where there might be just a very small percentage is something which you are able to manage, and that's how we have to look at recovery. That there is treatment, and there is recovery which is possible. But what is very important is to be very consistent and regular with the treatment once you engage in it and you start with it.
Okay, ma'am. So what is your opinion about psychological diagnosis from Google? That is the next question.
Should not be happening, because Google is not our mental health expert. It only gives you the information. We still have to filter it, and the right person to filter that information is your mental health expert, your doctor. So that's where you should be going actually.
Okay. So what is the right time period to inculcate the awareness of different disorders and the symptoms to recognize them? That is the next.
So like I spoke about our mental health curriculum, so what we did in that is from grade 9 onwards, we've spoken about disorders in a very simple terms, to talk about mental health disorders, what they are. But younger than that, so from age group of 6 to 8th, we've spoken about stress, that a child needs to know what are the signs and symptoms of stress, rather than just talking about disorders in big jargons. They need to recognize what are signals for stress, and the moment they realize that they are undergoing stress, then they reach out to a counselor, a family member, or a friend or a peer, and they take care of that.
Okay, ma'am. So next question, how to make a career in clinical psychology?
So you have to do your bachelor's with counseling as your specialization in third year, or in applied, I think you choose it in second year. Then you do your master's in counseling or clinical psychology, and then you do your MPhil. You can also do a PsyD. And with the changes in the policy that is coming in, I think a PhD or a PsyD is something which would be preferable ahead. But right now it's BA, master's, and MPhil.
Okay, ma'am.
An
So next,
MPhil from an RCI registered organization that gives you RCI registration. That is a must.
okay. Thank you, ma'am. And next question, are personality disorders treatable or manageable only? Can we treat that, or no, only we can manage it? That is the next question.
So they are manageable. Yes, there are certain aspects that we treat, and there are certain aspects that an individual learns to manage, and that again, it's a part of long-term therapy that one engages in.
Okay, ma'am. So next question, how can we enter your training program? So that's the question.
You can
Can you?
always write to us on mental health at the rate Fortis, at fortishealthcare.com, and we would be happy to get back to you. And whatever program we think you fit in, we'll certainly take you on.